Hi, everybody. I'm Dr. David Goldberg. I am the Director of Clinical Research and Cosmetic Dermatology for the Schweiger Dermatology Group. It's a large private equity dermatology group with 170 plus offices now coast to coast. I'm also clinical professor of dermatology at the Icahn School of Medicine at Mount Sinai. I'm going to talk about something probably nobody's heard about. It's a brand new approach to the treatment of the dimples of cellulite using carbon patch assisted laser treatment for the improvement of cellulite. And so let's talk about this a little bit. Skin tightening versus dimples of cellulite, there's a difference here. The true dimples are dimples of cellulite. That's very different than promoting skin tightening, which of course we've been able to do for quite a while already. So this is typical skin laxity. You treat this with a whole variety of devices. You can see on the mandible there, on the knee, the neck, the arm. We've been doing this now for certainly well over a decade. And when we try to promote tissue tightening with energy-based devices, our goal is to reduce skin laxity and to build collagen. Certainly, we can also use some of the biostimulatory fillers as an option for building collagen, but that's how we promote classic tissue tightening. That's not necessarily treating the dimples of cellulite. And ultrasound has been used. It's a very popular approach, not as skin tightening. Ultrasound energy leads to molecular vibration, but mostly it's through heat, anywhere from 60 to 70 degrees centigrade. And when we do that, we get coagulative necrosis of the adipocytes and collagen remodeling, and that's why we see skin tightening. And we get some mild fat reduction. And you can see here through this graph the inflammation, the proliferation, and ultimately removal, even of some fat, but certainly skin tightening. So here's classic. We've had two basic approaches over the last 15, 20 years. One was therapy. This was the MERS device. The other one is the Superb device. Both of them lead to skin tightening. The Superb device, of course, is a software device, which has become pretty popular these days. But notice it's skin tightening. And the same thing here, décolletage of the chest, treated with these ultrasound devices. There you can see before the rippling and then the tightening after some 180 days later. And take your pick. So many different areas. Arms, of course, are very difficult to treat. We do get some improvement. It's not as great as the improvement that you might see in other places. So that's ultrasound. And the other approach to skin tightening, of course, has been radiofrequency. And there have been, over the last 20, 30 years, so many different radiofrequency devices. There's monopolar, there's bipolar, there's the microneedling radiofrequency devices, all of which produce heat, in this case, not through ultrasound, but through electrical energy. So there's monopolar. And then what you have with this is you get this simultaneous heating, and then with some devices, even some cooling to protect the skin surface. This is the Thermage device, and you can see the improvement in the neck and the face there as well. And what happens when you do that, whether it's ultrasound or whether it's radiofrequency, you do get this increase in collagen that's present anywhere from 3 to 6 months after treatment, and that is what leads to the tightening. And you can see the improvement there as well. And the same thing on the knees. So whether it's ultrasound or radiofrequency, all these devices, and some people prefer one, some the other, are going to produce some degree of skin tightening, but none of them really impact on the actual dimples of cellulite. So here you can see the dimples of cellulite, classic dimples in the buttock there, the cheeks of the buttock. You can tighten this all you want. You're not going to get rid of these dimples. They've been very hard to treat, and it's amazing how many women come in, certainly younger women, complaining of these. It's a very common finding in women. As you know, the effect of estrogen on the collagen fibrils in women is very different than in men, which is why dimpling is a very common phenomenon in women, not all women, but many women, and rarely seen on the buttock and thighs in men. And so the approach that we've used, we've just finished this study, and this is known as carbon-assisted laser treatment photoacoustic effect. This actually is not new. I actually was involved some 30 years ago in using this approach, applying a topical carbon film to the skin and then treating with a Q-switch Nd:YAG laser for hair removal. And in fact, it worked very well for hair removal. It got FDA clearance. The problem was the FDA clearance was based on 3-month results, which were absolutely terrific. And then by 6 months, unfortunately, all the hair came back because this approach did not have a long-term impact on the actual hair bulb, the matrix of hair. That was followed by a study again some 30 years ago on treating photo damaged skin. And in fact, that was a long-lasting effect. Apply this carbon to the skin, treat it with a Q-switch Nd:YAG laser. We saw improvement in the quality of skin. But 30 years ago was the era of ablative lasers, such as CO2 lasers. The non-ablative approach to photo damaged skin had not evolved at that point, at that point in time, and therefore this approach never really took off. Well, it's back. And now it's back in the treatment of cellulite, and again, the dimples of cellulite, for which we do have some treatments. Subcision is a technique that can be used to treat cellulite, but it's somewhat complicated. You need to get underneath the dimples with some sort of instrument, break up these bands. It's really a more surgical approach. And then device-assisted subcision, this is known as the Selfina device from MERS, really took subcision to another level. But again, a very complicated approach. It takes time and hasn't really taken off all that well. What did take off initially for a little while was collagenase, injecting collagenase into these dimples, breaking up these bonds. But the company Quo is gone from the market. They declare bankruptcy, and then collagenase for the treatment of dimples also disappeared. So in essence, we're not left with much to use until we get to this approach. So this is the same carbon that I mentioned that we used some 30 years ago for hair removal and photo damaged skin. The difference now, it's really in a patch. When we didn't have it in a patch and it's simply applied to the skin, you can imagine the plume that was created when you activate this with a Q-switch Nd:YAG laser, something that would never take off now in 2025 and 2026. So now it's in a patch, it's protected. You fire at it with a 1064 nanometer Q-switch Nd:YAG laser. There are so many different brands on the market. These devices, of course, are used for everything from tattoos to pigment to photo damaged skin. But here now we're creating a photoacoustic effect in the actual dimples of cellulite. And so the study that I alluded to that was just completed, we had 30 subjects, typical ages, 24 to 50, Fitzpatrick skin types 1 through 6, with visible buttock dimpling. The carbon patch was applied, one patch was applied to each buttock, and then activated and treated with a Q-switch Nd:YAG laser over the patch during the treatment. The treatment protocol, we had two treatments spaced at 4-week intervals, and then we followed people for up to 6 months afterwards, and we looked at safety and we looked at efficacy. And if you look on the left, you can see those dimples on her left buttock, on her right buttock, and certainly on the right 6 months later, they may still be there, but certainly not as many, and the ones she has are certainly not as deep. And so you can see now we've had a selective effect, a photoacoustic effect, breaking up the bands that create the dimples of cellulite. And so this is a quick, simple, easy approach. There's minimal discomfort. It's got a high satisfaction rate, and there are virtually no complications that we've seen thus far. And so this is a totally new approach to treating the dimples of cellulite, carbon patch assisted laser treatment with a Q-switch Nd:YAG laser for the cosmetic improvement of cellulite. Thank you.